Hi, everyone, and welcome to another Making Physics Easy webinar. So today we'll be discussing metal-related hazards in MRI. And this is a webinar for radiologists who are sitting their FRCA Part 1 physics exam. So let's jump right into it. So first of all, here are a few types of incidents that we can see when there's metal-related injuries in MRI. So you can see there's MR projectile injuries here. There's the report of a 6-year-old boy who was killed in a freak MRI accident. So in this case, what happened was the machine's powerful magnetic field jerked a metal oxygen tank across the room, crushing the child's head. Similarly, an MRI machine, so that is in 2006. This was reported by ABC News. And we have another incident that happened in 2020, where a man was killed in Mumbai. So these are a few of the incidents that have happened with MRI machines that we need to look into what's happening. Okay, so another question we have to ask is, are MR incidents actually reported? So what we see from a study that was done in 2022 and published in the European Radiology Journal is that magnetic resonance imaging incidents are severely underreported. So let's take a look at the results of the journal. So the results of the journal show that only 38% of incidents were reported formally, and there's a negative correlation between the number of annual incidents and staff MR knowledge. So the conclusion that the authors of the paper drew is that MR-related incidents are greatly underreported, and some incidents have had catastrophic outcomes. So to achieve this, much more accessible education is required, as well as focused involvement of the management of the operations. So today, what we'll be looking at in today's webinar are the different kinds of incidents that might take place with respect to an MR machine, and what are the safety precautions that can be taken in order to make sure that these incidents do not occur. So let's move on to let's see what happens when metal comes near an MRI scanner.
Just walking into the MRI room now. So we're about 8 feet away from the bore. And when we get on this side angle, you can actually see the hole as I'm getting closer. Now we're starting to reach the head coil here. We're starting to see some pull at about 4 feet away from the magnet. We're getting 3 feet from the magnet, 2 feet from the magnet, and that's pretty much as strong as it's going to get, right at the edge of the board.
So that just shows us what happens when metal comes near the MRI magnet.
So, into the MRI room.
I won't do that again. Let's go to the next slide. Yeah, so what kinds of incidents can occur when metal is brought near the MRI magnet? So the ferromagnetic missile effect on metal outside the patient's body. There might be migration or rotation of metal implants or fragments within the body itself. There may be the current induction and heating of metal outside the patient's body and in implanted devices. So there's 3 magnetic fields, which, as we'll see during the course of the webinar, there's 3 magnetic fields which can cause these kinds of incidents to occur. One is the static magnetic field, one is the RF field, and one is the gradient field. And these various fields can cause these types of incidents to occur, and we'll go through these one by one and see both why they occur, what their effects are, and how they can be prevented. Some objects with metal in them are ferromagnetic. Ferromagnetic objects brought in the proximity of a magnet experience very large forces. So objects can reach speeds of over 80 kilometers per hour by the time they reach the center of the magnet. So what happens is there's some objects which have ferromagnetic metals in them, present in them. And when these metals are brought close to a magnet, they experience forces which are several times the force of gravity. And when these objects are acted on by these forces, they pull them in a certain direction, and the objects can reach speeds of over 80 kilometers per hour by the time they reach the center of the magnet, which is generally where the patient's head is positioned. So this is called the ferromagnetic missile effect. So how do we prevent from this ferromagnetic missile effect from happening? And that case, the incident that we saw earlier, where there was a 6-year-old boy who died, what happened in that case was that the machine's magnetic field had hurled a metal oxygen tank across the room, crushing the child's head. So things which are strictly not allowed in the MRI controlled area are metal oxygen tanks. If oxygen tanks are required, they provide oxygen through tubes which are suitable for use in the MRI controlled area. So here's how we protect against the ferromagnetic missile effect. A controlled area is established. All patients and staff must be sifted for ferromagnetic material before entering the controlled area, and potential missiles should be locked away in provided lockers. So potential missiles include mobile phones, watches, cards with magnetic strips, and clothes which contain metal. Something that's really important to know is that the static field is based on superconducting current coils, and this magnet is always turned on. Even when the machine is not in use, the magnet is always turned on. This is true for both permanent and hybrid magnets. So all staff need to either be trained on how to behave in the controlled area, or if they haven't received the right training, they need to be carefully supervised at all times in the controlled area. So let's move on to the next slide. So let's see what happens when metal comes into the magnetic field. So the magnet is being placed on the paper there. Fast forward it a little bit. So those are iron filings, which are ferromagnetic material. So you can see that what's happening is that the magnetic filings are aligning along the magnetic field lines. So a similar thing happens when there are objects with ferromagnetic material within the patient's body when they're subject to the magnetic field. So the static field may cause these objects to migrate within the body, that is to move along the magnetic field lines. And if the object is not aligned with the field, it may rotate like a compass needle within the patient's body in order to get aligned with the field. So this is another of the effects that can happen. This is due to metal with ferromagnetic areas or domains in them when they're within the patient's body itself. So the ferromagnetic missile effect happens with objects outside the patient's body, and the migration or rotation of metal occurs with metallic objects inside the patient's body. So this is one such case where the placement of a ferromagnetic intracerebral aneurysm clip in a magnetic field had a fatal outcome. So you can read this case report. You can take a screenshot of this if you'd like to find this paper. So the conclusions of the authors of this paper, this was published quite a long time back, 1993, is that MR imaging may be contraindicated in patients with biomedical devices, owing to the possibility of torque and dislodgement. So what happened in this case is that the patient developed an acute intracerebral hemorrhage in the MR unit with a fatal outcome. And imaging studies strongly suggested a torqued clip as the case. So other implants of concern near fragile areas include ocular implants and otological implants. All patients and staff should be taken through a safety. So how do we prevent from this type of migration or rotation of metal from happening? So all patients and staff should be taken through a safety checklist. The purpose of the checklist is to determine whether the patient or attending staff members have potentially hazardous implants of metal in their body. So patients who are unsure about the presence of metal, or if they're unable to communicate the presence of metal, either because they're unconscious or if they're of unsound mind, and basically if there's no reliable source who is able to confirm whether the patient has metal in their body or not, they need to be sent for a radiograph on which high density metal will show clearly. So in this case, the patient will be exposed to a relatively low ionizing radiation dose. So the clinicians involved have to take that dose into account when they're calculating the risk-benefit assessment of carrying out these imaging studies. If metal is present, the patient should not be allowed in the controlled area. So let's move on to the topic of current induction and heating. So many incidents of burns have been reported, and this phenomenon has been studied where the factors responsible for burns during MRI have been looked at. So most of the incidents of burns have been associated with metal cord ECG electrodes, with cables, or with metal cord pulse oximeter leads. The primary cause of these burns is the resonant antenna effect. So the RF pulses set up a standing voltage wave in the metal if the length is equivalent to the half wavelength of the RF radiation. The tips of the wires get hot rapidly and burn the patient. So there's multiple theorized causes for these burns to happen, and one of them is the resonant antenna effect. So in the resonant antenna effect, it's what happens is that the radio frequency pulses set up a standing voltage wave in the metal, which is present in the area. This happens if the length of the metal is equivalent to the half wavelength of the radio frequency radiation. So then the metal starts acting like an antenna. The tips of the wires get hot very quickly and burn the patient. So how do we prevent this from happening? Magnetic resonance compatible LEDs should be used, such as with carbon fiber cores or fiber optic cores. So these will prevent high induced currents from forming within the LEDs. Electrocardiogram electrodes should be placed as close together as possible to minimize the area of the conductive loop formed and the current which might be induced. Cables should be braided and let out of the magnet as close to the center of the bow as possible, as the fields responsible for current induction are at their lowest values there. A padding of at least 1 to 2 centimeters should be placed between the patient's skin and any cables. The padding should be placed between the patient's skin and the inside of the magnet bore. Face masks worn by patients should not contain metallic components. So there's a diagram on the left-hand side here, which shows the different types of magnetic fields and the various types of incidents that can occur. So the big magnet creates a static magnetic field. The gradient coil creates the gradient magnetic field, and the radio frequency coil creates the radio frequency field. So all of these fields can cause the malfunction of active devices. The static magnetic field causes translation and torque and projectile injury due to metal implants due to metallic objects outside the body. And the radio frequency field causes burns due to a number of phenomena, the chief of which is the resonant antenna effect. So implanted electronic devices may be subjected to current induction, which is where the applied magnetic field induces a current in the implanted device, and heating. So such examples of such implanted devices include cardiac pacemakers and implanted defibrillators. So theories as to why this heating occurs. First is that the pacemaker, the leads, and the myocardium form a single circuit which tunes to the RF frequency. A current is induced which causes the heart to contract rapidly, causing little blood to be pumped. Resonant antenna effect in the leads causing burns and thermal shock. So another few theories of why this heating and burns happens, or malfunction of the implanted devices. So leftover wires from the removal of implants may undergo the resonant antenna effect. Batteries and implant casings may undergo migration and torque. Torque is, of course, a turning force that causes the particular ferromagnetic material that we're talking about to turn to align itself with the field. Electromagnetic fields may cause circuitry to malfunction. For example, if the circuitry controls a drug reservoir, the whole reservoir may be rapidly discharged into the patient. So any electronic implant has a potential for these kind of adverse interactions. And the types of implants that can cause these kinds of interactions are neurostimulators, cochlear implants, brainstem implants, pacemakers, implanted pumps. So how do we prevent these things from happening? The safety checklist can be used to avoid these effects, and implants can be detected in other ways. Planar radiographs can be taken to show the presence of implants. Implants can be detected in other ways, including feeling the patient's body to see if you can physically feel the presence of the implants in some cases. Planar radiographs can be taken to show the presence of implants, but the important thing to remember when taking a radiograph is that it's contributing to the dose received by the patient. So in some cases, that might not be recommended.